Mexico is home to 14.5 million people living with diabetes, the world's sixth largest diabetic population. Despite this, only 39% undergo the annual eye screenings recommended by standard clinical guidelines. The consequence? 500,000 undetected cases of diabetic retinopathy every year, which remains the leading cause of blindness among working-age adults. The bottleneck isn't clinical intent, it is infrastructure and time. RetinAI Mexico solves exactly that. The system operates across 3 simultaneous layers. Vision performs fundus image classification utilizing fine-tuned MED-GEMMA and MED-SIGLIP models. Documentation transcribes the clinical encounter and generates medical notes in strict compliance with NOM 004 standards. Audit validates the clinical note against Cenitech clinical practice guidelines and generates a FHIR-compliant bundle for secondary care referrals. The entire workflow is orchestrated by a 10-node LangGraph agentic graph. Let's see it in action. Primary care setting: 52-year-old patient with diabetes, proceeding with fundus image upload. MED-SIGLIP completes the initial screening in under 100 milliseconds. Upon identifying pathological findings, the system escalates to fine-tuned MED-GEMMA for a granular analysis. Clinical finding: Grade 2, moderate retinopathy, 85% probability. Attention mapping: the visual overlay pinpoints the exact retinal regions that triggered the model, specifically identifying microaneurysms and exudates localized in the superior temporal arcade. Automated triage: the system autonomously generates a clinical triage plan, recommending a scheduled referral within 4 weeks. The clinical note enters the agentic graph. A 10-node sequential workflow: patient validation, image analysis, audio transcription, clinical note structuring, triage, and clinical audit. Audit score: 84 out of 100, surpassing the 80-point pass threshold. Actionable UI fields highlighted in red indicate mandatory physician inputs required for completion. Safety protocol: should the clinical note fail validation 3 times, the system triggers an automatic escalation for human oversight. The system operates entirely offline. Model optimization: the INT4 quantized MED-GEMMA 4B model is engineered to run on standard hardware with as little as 6 GB of RAM. Data resilience: patient records are stored in a local SQLite database and synchronized asynchronously once a network connection is established. Purpose-built architecture: specifically designed for rural deployment, ensuring that life-saving diagnostics reach the underserved populations who need them most. RetinAI, created to redefine the visual destiny of the 14 million Mexicans living with diabetes.